Are you already registered?
I would like to welcome you again to our series Natural Medicine. Nice to have you with us again and to accompany us through this next conversation. With me today is Marco Klein, founder of BioRelax and co-developer of Klein Fields. And today we have chosen the topic of fibromyalgia, a special, very specific disease that can only be diagnosed after lengthy examinations. But we'll find out more about this from Marco Klein in a moment. Stay tuned, it's going to be interesting. Dear Marco, welcome back. It's great to have you back.
Thank you for having me.
As I've already mentioned, we've chosen a difficult topic today, a very painful topic for those affected. The disease fibromyalgia is also difficult to diagnose and has many symptoms. But perhaps we'll talk about that right now in the introduction. So what is fibromyalgia? Maybe you could explain that again for our viewers.
Fibromyalgia, that also affects us very, very much in our everyday consultations, because it is a disease that is felt to be on the increase. And for me, when I first heard about it, it sounded like an unknown illness, but it's much more common than you might think. It's unbelievable, but it's not quite so popular, the disease, because the diagnosis is also very difficult and usually takes a long time. But fibromyalgia, to put it briefly, because many people always talk about muscle pain and the like. That's not quite true, although it is in muscle areas. But it's actually a chronic pain disorder. And the cause of this is not yet entirely clear in research. But it's in that area that it is said to have a strong neural connection with the nervous system. And as a chronic misperception, you could say. In other words, it is an increased perception of pain. And that is actually something that many people compare with fibromyalgia, this pain, which is a bit like rheumatism for many, like joint pain and the like. But it doesn't really affect the joints, but just the tissue around them. And that's why it's very common in that area, in the muscle insertions, at the tendon insertions, but as a pain disorder you could say, in general terms.
How can a affected person recognize that they are affected, that they have fibromyalgia? So how does it ultimately manifest itself? What are the symptoms?
Apart from all the suffering, that's almost the worst thing about the disease itself, is that it is incredibly difficult to diagnose. That it really isn't made easy for the doctors, because it is said that in medicine it is the chameleon of the disease, because it can have an incredible number of different variants. And that means you can't say that it's one symptom and this is now fibromyalgia. That is because you can't measure it in laboratory values. You can't take a blood sample and see in some laboratory value, that indicates it. And that makes it even more difficult. And that's why it's complicated for people to diagnose, because the doctor treats it like a disease of exclusion, so to speak, because there isn't the examination or not the symptom, but usually a concatenation of several things until it actually shows up that it has to be that. It's difficult for those affected. If the doctor perhaps has few cases and has little experience or cannot interpret it precisely, then the patients usually suffer for years. So until most of them have a diagnosis, it takes years, which means that they have undefined pain and say that everything hurts. Pressure sensitivity in particular is an issue for many people. So that goes a bit further, I'll explain in a moment. But it takes an incredibly long time to get a diagnosis. And then, of course, there are various tests with the pressure pain, which I said, because there is a different sensation of pain. Then some tender points are pressed, so to speak. These are points where there are tendons and muscle attachments. And then, when certain pressure points fit, that is already an indication of this. Another indication can be if someone also has restless legs. So there's an unpleasant tingling sensation in the legs, a pulling sensation, something indefinable, where you say you don't feel well. which some people also experience with an electric kick of the leg sometimes. In other words, when these pressure pains, restless legs, are added in this form, also psychological. Then there is also the issue, how are you feeling mentally? Do you have sleeping problems? Are you stressed? Because most people almost seem like someone who is depressed because of the psychological stress. And if that fits psychologically with the pain points, the high perception of pain and, in the best case, restless legs, then it's pretty clear that it's fibromyalgia. But it takes a long time to get there, through all the tests and what the doctor then does. It's very frustrating for people because they don't feel like they are being taken seriously. Because of course there are also cases where the pain can be imaginary. This is very often misunderstood in the case of fibromyalgia. Then it's said that someone is imagining pain and they say, I'm not imagining it. I'm not stupid. It does hurt. And if you're not properly recognized by the doctor, then of course it takes time until you've seen various doctors and then you start to suffer, because then certain pain medication doesn't help, like ibuprofen, diclofenac. If there's no help in that form, then it's simply an insanely high level of suffering. Pain that feels chronic and is always there is a catastrophe for many. The stories of suffering we have heard, nobody wants to imagine.
No, that's why it's always difficult to talk about it, because you can't really empathize with how people suffer. Or how it feels.
The psychological strain, just the idea of it, having the pain all the time. No one can really help you because there isn't even a therapy solution per se. It's a combination of several things. But as I said, even if you have the diagnosis in the form of a tic, because then you know what you can perhaps do therapeutically.
What is the enemy? Who is the enemy? No, nonsense.
But of course the first step is to determine that for yourself, because even if it's the Rheumatism League, which then also makes statements about it and says that it's not just a kind of pressure pain, but that absolutely most people also have very severe sleep disorders. And that is what drives this whole problem very, very strongly. Simply because I already have trouble sleeping due to pain, because I feel like things are hurting me, I can't rest so easily and I can't relax mentally because of it, then it's usually the case that the restless legs don't feel good, tingling or something similar.
Kommt dann meistens eben, wenn das Restless Legs vielleicht noch mit hinzuspielt, dass die Beine sich nicht gut anfühlen, kribbeln oder ähnliches.
Then you actually move around to somehow shake off this feeling a little.
Dieses Gefühl irgendwie ein bisschen abzuschütteln.
That doesn't help your sleep either. Ultimately, that means that, I don't want to say almost everyone, but the majority are affected by massive sleep disorders. Whether it's difficulty falling asleep, sleeping through the night, or whether patients simply say in the morning, I actually slept, but I feel exhausted, as if I could sleep for another 10 hours. And that's actually the problem, as I said, like a vicious circle. If I already have the physical complaints and mentally I don't get into the rest phase, so I have a light sleep. Reaching this REM phase, this deep sleep phase, is then more difficult. Then I'm not refreshed the next day, I'm naturally much more sensitive nervously. I compare it to a rain barrel. When it's full of water, you only notice when the water overflows. And when it's already very full, then everything that drips on it. The psychological stress in everyday life, whether it's being a parent, whether it's stress at work, whether it's existential worries, everything that can be there in any form, that all adds to it. You have very little energy to deal with it. And then you have the feeling it's like a conspiracy against you, because nothing seems to help. In other words, these sleep disorders, that's why many people take antidepressants and various medications such as opiates and the like, simply to get a better night's sleep. But of course, in the best case scenario, this is not a permanent solution. But if it's the only thing that helps, many people unfortunately resort to it. That's why these sleep disorders, that's a striking point. And then of course there are a few other things. Whether it's headaches, whether it's gastrointestinal complaints, discomfort in the feet or hands. All the problems that are listed. Unbelievable. So these are all symptoms of fibromyalgia. You could diagnose it as 1,000 other illnesses. But that's why I mentioned the chameleon. It manifests itself differently in everyone. One person has headaches, the other doesn't. One person has stomach problems, the other doesn't. That's what makes it so incredibly difficult for doctors.
What are the causes of this? What can I look out for as a viewer that I say, oh, keep that away from me, fibromyalgia? What can I do to prevent it?
So due to the variance in the end, it makes it not quite easy to answer this question. But overall, women are up to 9 times more likely to be affected. That's why it's known as, I don't want to say, a typical female disease. But as a matter of fact, women up to 9 times more. So you can imagine how much. And of course that makes it difficult for them, because of course it can be linked to smoking, with poor sleep overall because of the psychological stress. But whether it's obesity or lack of exercise, so many factors can also play a part. But of course, genetic predisposition plays a role for some people. It's not the only issue. People are always so quick to blame genetics. Yes, it was in my family. That's why I must have it. No, it's not inevitable. But the risk is of course higher. And if certain environmental influences etc. are added, it can of course break out more quickly. But most people realize that then, just like relapses occur, when they have a lot of stress. So when the psychological strain is high due to normal work stress etc. Perhaps the diet was not quite as good, which can then cause small inflammations or similar. It doesn't have that much to do with fibromyalgia, but it often occurs as a result of rheumatoid arthritis. This means inflammation in joint areas, which is known from arthritis. So the old people, to put it bluntly, with their joints. That's why this joint stiffness, which is very typical in rheumatism, is also very common in fibromyalgia, and then so many things come together. So it's not so easy to say what the exact causes are. That's why it would be nice to know. But we do know which factors are predominantly the case with fibromyalgia patients. It's the ones I mentioned.
You've already mentioned it briefly how it is treated. So with pain medication, opiates, and so on and so forth.
Exactly. In the case of fibromyalgia, it's really important because there isn't just one therapy. In other words, doctors who know about it would always work on several levels. They would also not say as a therapy, let's just start with medication, then we'll do exercise physiotherapy and the like. Instead, the most promising approach, usually says, is to combine many things together. Physiotherapy and medication, as well as more exercise and the like. In other words, a wide variety of factors, because when they happen at the same time many things can work together and people are more likely to experience relief. That's why it's a multi-therapy, you could almost say. But it's very important. You can't just leave it to the doctor, you have to take a great deal of interest in illnesses yourself, but also take a great deal of care of it yourself. When driven by pain, it's not so difficult for some now, because pain is always the best driver to do something for yourself. The main thing is to stop it somehow. It can hurt anywhere in the body, whether it's in the joints or in the arms and hands. But for most people it's in the legs, in the hips in this case. Therefore, if it can happen in several places, and in the picture you can see the typical back problems, which many have. But it can be in all sorts of places. Of course, that's what makes it so frustrating when it's sometimes here, sometimes there, maybe even wandering.
That can also be the case.
Well, it's not always in the same place. But many people feel it in their spine, the back area. That's very, very typical.
And legs, right?
Legs are also a problem, yes.
Okay. You've already had experience with your Klein fields. You are extremely diligent with your studies anyway in the most diverse diseases and so on. You also have fibromyalgia. I think you already have feedback from patients or customers who have used it. What can Klein fields achieve? How can they change the symptoms or support or eliminate the clinical picture?
In the past, when we didn't have many study results available, we couldn't have imagined it either. Fibromyalgia at first, because the disease was not so well known to us. That was many years ago, until the first reports of our experiences came in, who then reported what happened. Whether it was people in employment who said, I no longer have any pain when I'm at work, when I'm on one of these sleeping mats with Klein fields at night. Because they were better rested, slept better, but then have sometimes reported, well, in the late afternoon, then the pain slowly returns. So it didn't go away completely. Then they would lie down for another hour and then it would last until the evening again. Other patients reported that they no longer had any problems at all. With the next one it might have been, yes, it doesn't come so often anymore. So it's there much less and when it is there, it's a little weaker. So the fact that fibromyalgia is so varied, it is perhaps not easy to say in general terms. We only get the reports. We don't have any medical data available. But of course that has shown us something seems to be happening. Otherwise there wouldn't be so many, it wasn't just an individual report. And then, of course, we asked ourselves the question, because it is very well known that Klein fields support blood circulation. Many people say it's the circulation therapy par excellence, which also has a lot to do with aching legs, etc. But the fact that fibromyalgia is a nervous system disorder means you have to be careful, because we don't know exactly, but it has a lot to do with it. We have known since the study by the University of Mainz, which measured brain activity in the EEG, not in fibromyalgia, but in general. But they were able to demonstrate wonderfully that something happens in the brain through Klein fields, and clearly so. If you imagine two heads like this, if you imagine them as a picture, there is little activity, it is very dark, and there are Klein fields on the body. There was even a study measured with just insoles, so even very little surface area. And the brain began to light up in the area of movement control, light, deep relaxation was clearly promoted. And that was of course interesting for us, because we found that, and now comes the explanation behind it, because it's still a theory, because we don't know the exact mechanism of action. Why does it work so well? We always get the question. We don't know exactly. But the theory behind it is because Klein fields mainly act on moving structures. Perhaps those who don't know about Klein fields, I can show you a picture so that you have an idea of what Klein fields are, because this is a permanently magnetic surface where there are simply alternating plus and minus areas. And that then looks a bit like a little chaos principle, because the plus and minus change in all variants and facets, including the field strengths. This can then be in different products, in mats, in insoles, in pads, etc. But to put it simply, the blood moves just like the lymph and also the nerve signals constantly through our bodies. This means that the heart pumps the blood in motion, the lymph is an inflow from the blood, so to speak, but also the nerve signals. In order for me to open and close my hand, a signal must constantly go from the brain to the hand and from the hand back again. Because when I pinch myself here, a signal has to arrive. In other words, they are all electrical stimuli that are shot through the body at around 300 km per hour. If you prick here, 300 km per hour. That's why they say reflexes, how fast the nerves actually are. But now we know, the nerves are moving. And the fact that Klein fields with their plus and minus configurations can theoretically influence electrically conductive liquids or nerve signals. And that's where the theory comes in, when a nerve signal travels across these plus and minus fields, plus and minus alternating, so to speak. This is an electrical signal, so it can also be influenced, so something must be happening with the nerve tissue, either with the nerve cell, or with the signal that this pain message is somehow changed. In a positive way, you have to say. And that means that the pain doesn't happen here in the muscle, or there, where the problem is, but it is an electrical stimulus. In other words, I have pain somewhere. Now an electrical stimulus is sent to the brain, and only in the brain it is translated. These are all just electrical stimuli, and the brain suddenly says there is pain. So that means it is translated here. Now comes the issue, when the brain is of course more active, it can process stimuli better. It has even been measured in athletes. Reaction speed has increased. They made fewer mistakes in tests. Their concentration was significantly better. And that's the theory behind it, it's this high level of brain activity, and because many studies, there are numerous studies that suggest that permanent magnetism relieves pain. And great studies in various areas. And that's why Klein fields work on a similar basis, but are even more complex in form. That's because we have an incredible amount of experience reports in a wide variety of areas when it comes to pain disorders. Also polyneuropathy and so on. And that's the interesting thing, when we already know that such permanent fields have a correspondingly great effect on pain. And we also know that the brain is also activated in a positive way. Then two aspects probably come together that ultimately reduce this feeling of pain. That's this misperception, as I said. And that is the theory behind it. As I said, we would now have to carry out further studies to see how many people have relief in different ways. But we think it's very, very logical that it must be because of the blood flow, as many people know this because they've seen lots of videos and the like. It also supports the blood circulation, which can also supply the nerve cells better. Of course, good blood circulation means that more oxygen and nutrients reach the cells. The nerve cell also has to work. That's why it's often the case with nerve damage such as polyneuropathy, but perhaps also fibromyalgia, when the nerve cell doesn't work well, because it is perhaps not well supplied with blood, not enough oxygen arrives. That is the most important thing for the cell, that it then comes about in such a way that its function is perhaps restricted. That's why it can't be ruled out if you lie on such a Klein field sleeping mat. Through blood circulation and the nerve signals, everything then runs through it, so that the pain may even increase at the beginning. Why? If I increase a nerve cell in the performance, then it says I can report the pain better. And then the patient says, for God's sake, it's even getting worse. Then you can dose more easily in the form. But it's important for the body to get this regeneration. It rarely happens. But if 1 out of 10 people says, oh, I slept on it, I feel worse even after the first night. If they then slowly increase it, they are usually very, very happy in the end. But these are phenomena that you then see, which is probably related to the cell performance. Which is why this disorder is there. Whether it's genetic, whether it's environmental stress, whether it's certain issues in the body, it's not easy to predict. But there are probably several aspects to this. So blood circulation, cell performance, activation. What does activation mean? But the nerve signals that pass through the alternating fields and are influenced. It is measurable energy that can really be measured in the body through Klein fields. That something happens there. And the areas of the brain. These are probably 3 effects that come together. According to our theory, that's why these experiences come about.
Yes, it makes total sense. You talked about studies. Do you have any studies for fibromyalgia planned again?
Exactly. We have planned it. The study doesn't make it so easy because in studies you like to measure laboratory values and the like. And that's not the case with fibromyalgia. That's why you have to work with patient surveys, of course. Or just have the diagnosis from the patients in the first place. So we are planning studies. And we believe that there is no cure in this form. There is also no therapy that is really promising. Usually only several therapies together, which then provide relief for the symptoms. Symptoms. That's why Klein fields would probably be a very, very good building block. But not everything. So it's not the case that the Klein fields would replace everything. Talking, eating, and exercise. And like some people think, I've got this miracle mat and it has to do everything. That is probably a very important component. And that's where we want to conduct the studies. Nice and large, double-blind, placebo-controlled, randomized. The kind of studies you do. Costs a lot of money. Takes a very, very long time. But that's why we need to know the parameters more precisely. How long do you actually have to lie on it to find out certain things? We want to carry out a kind of preliminary study. And that is theoretically where viewers can also get in touch. We're doing it as a free study for patients in order to document it even better. How long does what take? Are there differences between age groups and the like? Because we have seen with other disease patterns that there can always be small differences. Even if the feedback from patients is always very, very great. We're delighted, of course. But yes, to take another closer look. That's why you can get in touch with us and virtually participate in the examinations. Because there are no side effects. That's the nice thing.
Yes, exactly.
There's nothing to lose. Of course, that makes it relatively easy for studies. It's not like medication, where I have to be afraid of what will happen to my body. It's simply better care for the body, a better supply for the body. And what the body does with it. From the activation of blood flow. Whether it's the nerve signals, the areas of the brain that work better. Because we know that. We know that. The only question now is, how exactly can you see it in fibromyalgia patients?
Well, that's what I always find so great about your company, that you always conduct studies for so many different clinical pictures. Because you simply want to provide evidence. And you're also interested in the effectiveness of your technology. And then, as a viewer, you can also rely on the fact that you can say, okay, that many patients have given positive feedback that something is developing positively for them. And above all, it's not just a case of treating the disease fibromyalgia in particular. But with the Klein fields, so with this technology, I really do have the opportunity to do something good for my whole body.
And that's the belief, because we've talked a lot about the pain itself, which is the main reason why people do things, why people do something. I believe that the great success in the testimonials in these areas is also due to this. Because every second testimonial, whether fibromyalgia or other illnesses or healthy people of course, not only in the treatment of the disease, but actually every second experience report better quality of sleep. And that's interesting because if I can sleep better naturally, I can enter the relaxation phase better, both in the brain, as mentioned, and in the body. Because everyone's blood is thicker at night. Less oxygen enters the body due to shallower breathing. This means that where the regeneration phase is at its best, our blood is least able to flow. This means that oxygen is not transported to the cells as well as during the day. And the removal of metabolism, waste products, cell toxins, as they say, is also poorer. That's why at night this regeneration, which is actually also important for nerves and so on, is more difficult anyway. And if, of course, the support of the blood circulation coupled with the activation of the brain can easily lead to this deep relaxation phase, when you speak of brain waves that are measured, alpha activity, 4-hour relaxation, or theta activity, when you start meditating or wake up slowly in the morning, you're still in theta activity, where you are incredibly relaxed. And that's just caused by Klein fields, according to the study by the University of Mainz. And of course that makes sense, that these effects come together. And I assume that this is the case when the night's rest is of course different. I'm fresher the next day, in other words, I'm under less nervous and psychological strain as a result, so I can of course withstand a lot more things that are going on around me. And will probably be able to cope with the whole pain, which means that many people feel better just because of that, because these sleep disorders, which are the greatest evil, because you can't recover, that it's this combination that probably makes it so successful, in addition to the pain anyway.
Great. That's a glimmer of hope for those affected. Wonderful. After all, I think we talked about it briefly at the beginning, before this conversation. 2 out of every 100 people are affected by this disease.
Yes, that's what they say, exactly. So fibromyalgia mostly affects people between the ages of 30 and 50. Sometimes, but rarely, it can also develop later, but rather often in this age range. And if, of course, women are affected to such a high degree, they naturally experience this level of suffering. You can only ever mention it, because nobody can probably understand it when you feel chronic pain almost every day. And you feel really bad.
I don't even want to imagine it, because if I imagine having a toothache or something like that, it's only temporary. And there is a solution for that, but having to endure it permanently.
If I can look at it physically, because what Klein fields do, let's see, exactly, because otherwise it looks static in pictures. But the Klein field is a permanent field, something is moving, you just can't see it. If you go over it with a compass, the needle will move back and forth all the time. But of course, if it's constantly acting on the nerves to calm them down, to process nerve signals differently with the brain, then that seems to be very, very exciting in research. And of course it would be great if we could say at the end that yes, we have the proof of the study, the first really successful therapy. Because if you only get positive experience reports, then of course you don't know. If you now put 100 people on it, how many of the 100 people you only get positive reviews, so you think that it somehow helps everyone. And of course it often won't, because the circumstances are certainly very, very different. But if you still know, according to the results of the study, that the majority of people are helped, whether a little or a lot, there will probably be a variance. But any relief, even if it's small,
Is a gift.
Exactly. And that, I think, will be the big factor.
You mentioned that you have to.
So it's basically just the blood circulation that I mentioned. Because of cell supply, what happens there? The blood flow is of course a factor alongside the nerve tissue and the brain.
Okay. You said earlier that people can apply to take part in the study. Is that possible right now?
Yes, you can. Exactly. We don't know exactly when it will start. But you can get in touch first. Then you can tell us what problems you have. Perhaps you already have a diagnosis? That would be particularly good, of course. But let people get in touch. You just have to look for BioRelax on the internet.
Exactly. That's what I wanted to know. For our television viewers who don't watch YouTube, for example, that they also know where they can turn.
So if you look on the internet for Klein fields, that's the technology, or BioRelax, that's the brand under which Klein fields can be found. If you search that on the internet, you will definitely find it. and then simply ask by phone or email.
Very good. Okay. Then thank you very much for all the insightful information you've given us about this disease. And I hope that as many people as possible will get in touch and that a very successful study comes out of it.
I hope we can help a lot of people.
Exactly. That's right. Thank you very much.
Thank you.
Many thanks to you too, dear viewers. I hope, of course, that you are not directly affected by this disease. But if you are affected, then there is now the opportunity to participate in this study. Perhaps you would like to take advantage of this. Otherwise, we hope we have once again suggested a good solution. And we look forward to hearing from you again next time. Until then, please remain mindful, vigilant and loving towards yourself. I look forward to the next time. Until then, see you again.